So at the outset, I would like to thank Team JPEF and organizers of the CME for having us here to chair the session on muscle nutrition. Of late, we are hearing more about muscle mass, how to preserve it as the age advances. And also with the social media, the term sarcopenia has gained more attention. So it's all about how to keep these muscles alive by feeding them properly. To enlighten us on this topic, we have Dr. Rakesh Sahay, who is the president of South Asian Federation of Endocrine Societies, Diabetes in Pregnancy Study Group of India. He has been the president of RSSDI Endocrine Society of India, and he has been awarded with the Best Teachers in Medicine Award from Government of Telangana, and fellowships from Indian College of Physicians, Indian Academy of Clinical Medicine, Sri Lanka College of Endocrinology, and he has got over 200 publications on his credit. Over to you, sir.
Kind words of introduction, and at the outset I would like to thank Dr. Jyoti Deva and his entire team for inviting me to be here, and congratulate them on the excellent meeting that has been organized, and I thank them for giving me this opportunity to speak on this this topic about sarcopenia, because as the chairperson has highlighted, sarcopenia is there's a growing realization that we are a population which is sarcopenic. We tend to have what is called as sarcopenic obesity, where we have less of muscle mass, increase in the fat content, and what we are seeing is that basically we are protein deficient. 73% of our population is protein deficient, and most of us rather, you would say over 90% are unaware of the daily protein requirement, and 85% believe that protein consumption leads to weight gain. So therefore they are cutting down. When they're trying to cut down on calories, they're cutting down on the protein intake, and that's the reason why low protein intake is a major challenge in our diet, and that leads to weakness and increased hunger, increased susceptibility to infections, muscle atrophy, and so on and so forth. Even effect on the mood and cognitive impairments, and increased risk of stress fractures. All these are related to sarcopenia, and that is something which is a growing realization of. This has been happening in the last few years. We are seeing that sarcopenia is related to the risk for development of various complications of diabetes, also is related to the sarcopenia. And if you once again look back at the average protein intake, we are seeing that Indian diets probably have the lowest average protein intake compared to all other diets from across the globe. And the RDA, recommended dietary intake for proteins for adults, is 0.83 grams per kg body weight for healthy adults. That may translate to about 54 grams of protein for a average person weighing about 65 kg individual, who's regardless of the physical activity or gender. We would say that requirement is about 54 grams. So it can vary from 54 to 60 grams, we would say, is the average protein requirement in healthy adults. And for older individuals, we require actually a little higher protein intake, because of the fact that they tend to have a progressive loss of muscle mass as age advances, and therefore what we are saying is that 1 to 1.5 grams per kg body weight, which amounts to a higher protein intake than what we are seeing in younger adults, and this may the requirement may be about 25 to 30 grams of protein in each meal would be appropriate for such individuals. Now, if you look at the muscle mass, like the bone mass, we are aware that there's a peak bone mass accrual at a particular point of time, and then the bone mass decreases over the years coming as the age advances. So even for the muscle mass, what has been shown is that the peak muscle mass is achieved between the age of 20 to 35 years. So muscle strength also is again an important parameter that is used for assessing the muscle health. We may not be measuring muscle mass in everybody, but muscle strength with a dynamometer, hand grip dynamometer, can be a good measure for assessing muscle function. Muscle mass starts off as early as the age of 30 years and may progress at the decline is in the range of 3 to 8% per decade. So that's a healthy decline. If that is, healthy decline means that is a physiological decline, you would say. But this gets accelerated in older individuals. And this can happen even in diabetics. It has been shown in some studies that the decline, muscle decline, is little faster. And the rate of decline in older individuals is 1 to 2% per year. So from what was 3 to 8% in a decade is becoming more, 1 to 2% per year. And more than 10% of young adults across most ethnicities are shown to suffer from sarcopenia. And there are factors. I mean, the sarcopenia is influenced by genetic factors. It is influenced by nutritional factors. Nutritional factors, we all seeing this just now. We are discussing about protein intake in the diet. We are discussing about physical activity. Keeping the muscles active is important. And also factors like smoking and alcohol consumption can have an adverse impact on the muscle mass itself. Now, the genes, if you're looking at genes which are influencing the muscle mass, it is the IGF-1 gene and the vitamin D receptor genes. They are contributing towards this the accrual of muscle mass and the muscle. So those are the two genes that have been linked to this muscle mass. Now, if you look at, this just gives us an illustration that what is the prevalence of sarcopenia in our population. I mean, we speak about diabetes, we speak about hypertension, we speak of cardiovascular disease, because these are very obvious chronic comorbidities that are seen with people who are obese. And we see that obesity, particularly when you look at obesity, is prevalent to the tune of about 13% to 57%. I mean, 13% is overall obesity, but if you look at abdominal obesity, it goes up to almost 60% in our population, and women are very prone to abdominal obesity. And what we are saying is that if you look at even osteopenia and osteoporosis, it is to the tune of about 30% and of 20% of osteoporosis, and osteopenia being about 48%. And similarly, when you look at poor muscle mass, we are saying that this again, it is similar to these figures. And irritable bowel syndrome is again another comorbidity which is present in many people with diabetes, and it is present in the prevalence of that is in the range of about 4 to 7.5%. So let us look at the influence of various nutrients on the muscle mass. As we said, that is one important factor. So we are saying that muscle the factors that influence muscle development are, one is the muscle exercise that an individual is doing, because that stimulates muscle growth by triggering the repair and strengthening of muscle fibers. And apart from this, diet has an important role to play, particularly when you're looking at the amino acid intake from the diet, which are essential for muscle repair and growth, and they highlight the significance of dietary protein. So dietary protein is one aspect, and the exercise itself is another aspect, which are the two aspects which are controlling the muscle mass. And as we know, the various functions that muscles provide, and this slide typically illustrates all that we discussed just now, that what happens is with inactive sedentary lifestyle, or the adverse influences like cigarette smoking, excess alcohol consumption, or low excess calorie intake with low protein intake, and vitamin D deficiency, all of them contribute towards decrease in muscle protein synthesis. They increase the muscle protein degradation and have a negative impact on the muscle function and quality. And ultimately this translates towards loss of skeletal mass, strength and function, as we would define it as sarcopenia. So all these factors are contributing towards the development of sarcopenia. Now, if you look at people post the age of 35, joints undergo degenerative changes due to diminished tissue repair capacity. Optimal musculoskeletal health is critically dependent on the synergistic role of proteins, calcium and vitamin D particularly, in maintaining the structural integrity and functional capability of bones, muscles and joints. The proteins have an important role because they are responsible for providing the structural matrix of the bone, and they are crucial in muscle growth, physiology and metabolism. Calcium is a dominant component of the bone matrix, and it contributes to strength it contributes to the formation of the matrix along with other elements, and therefore it is important for the formation of the skeletal structure. Vitamin D is involved in the differentiation, proliferation and growth of the muscle cells. So vitamin D has an important role in regulating growth of muscle cells, and also modulates the muscle contraction and strength by controlling calcium homeostasis within the muscle tissue itself. Now, how is the gut having a role on muscle mass and muscle formation and muscle function? So it has absorption on, because it influences the nutrient absorption. We spoke about all the nutrients having an impact on the muscle strength and function, and maintaining a healthy gut can significantly reduce the occurrence of the functional gastrointestinal disorders, which we see are very common today. And and because of that, you have all these symptoms related to irritable bowel syndrome, which are all put together to say that, when you speak of irritable bowel syndrome, these are all these common symptoms that we see, which are all part of the functional gastrointestinal disorders. And a healthy gut overcomes all these problems, and the gut microbiota have been shown to have an important role in terms of in various ways, not just one way, but they provide, they improve the metabolism because they help in metabolizing the non-digestible carbohydrates. They provide energy for the host, and they also have a role to play in the synthesis of vitamins and amino acids. They inhibit the growth of pathogenic bacteria, and they produce antimicrobial compounds. They also have, there's also what is called as gut muscle axis, which we now speak about the gut having a role in almost many other disorders. We have gut neuro axis, gut muscle axis. So gut muscle axis improves the protein digestibility, gut permeability, and through the production of these small chain fatty acids, which actually have anti-inflammatory effects, and they enhance the insulin sensitivity in the muscle cells. So overall, there is an improvement in the muscle function with the improvement in the gut microbiota. So therefore, what we are seeing is that by improving gut health, we are seeing improvement in the muscle function and muscle development, which could say, and therefore there seems to be a role for these prebiotics and probiotics, which can have an impact on gut health. So what are basically prebiotics? They are defined as the non-digestible oligosaccharides, which undergo transformation by beneficial colonic microorganisms to potentially offer health benefits to the host. The prebiotics nourish other beneficial bacteria by supporting their growth and reproduction. So there's a close interaction between these prebiotics, which are doing this, which are getting transformed by the probiotics to provide these benefits, as we have seen. So the effect of these probiotics on human health has been shown to be towards improving the immunomodulation, normalizing the gut microbiota, and also translating to metabolic benefits. So you can see that there is decrease in allergy, reduction in inflammation, improvement in immunity, and improvement in the mucosal immunity, particularly at the level of the gut itself, thereby decreasing gut infections and having metabolic benefits in terms of improving the lipid levels, and also improving the lactose tolerance and vitamin synthesis, particularly the absorption of B12 and other agents becomes important. The pre and probiotics have an important role in protein absorption also, and improving the muscle integrity, because they regulate the intestinal flora. They induce host digestive protease and peptidase activities, improve small peptides and amino acid absorption. They reduce the harmful fermentation factor, harmful protein fermentation, and thereby influence the dietary protein digestion and utilization. So through all these mechanisms, the pre and post probiotics have a significant impact on the muscle integrity and muscle function. So this is a very busy slide, but basically trying to put everything together that we just spoke about in the last few minutes. It's putting all that together to say that there is in fact a gut muscle axis. The gut is influencing the muscle function, and through the various mechanisms which we just discussed, and that has an important role to play. So we have probiotics like the Bacillus coagulinus. It's a unique IS2 and has good health outcomes. It improves the adult gut health, improves the muscle strength, and it has been studied in different ways. It has been studied in toxicological studies have been done in and also the benefits of human consumption have been shown in after the animal studies. The benefits in human consumption have also been illustrated. And the benefits that have been shown, the properties are that it produces various digestive enzymes which aid in efficient nutrient breakdown and absorption. It has antimicrobial properties. It improves the vitamin synthesis, and it has probiotic potentials. And therefore, it is resilient and thrives in both aerobic and anaerobic environments, and ensuring survival through the gastrointestinal tract. So this Bacillus coagulans, unique IS2, is the one which has benefits which can which have improved the gut microbiological function. So when it's supplemented along with whey protein, it has certain benefits, and that has been shown in this study, which involved 138 individuals who were randomized in a double-blind way to receive this protein, this formulation, and the placebo group received the normal whey protein formulation, and the intervention group received this along with the whey protein plus the 2 billion CFU of Bacillus coagulans, unique IS2. The results of this study was that the group that received this Bacillus coagulans had improvement in total BCAA levels, including isoleucine, leucine, and valine, were improved. The levels of this improved, and there was improvement not only at the molecular level. You could see these improvements in these molecules which are studied, but also there was improvement in exercise performance, and there was a improvement in various muscle performance parameters were improved. So supplementation with Bacillus coagulans, unique IS2, along with whey protein, significantly increases the BCAA absorption and improved the muscle power in the lower body, suggestive of a positive effect of the probiotic on protein utilization and exercise performance in resistance trained males. So going on to show that this combination of whey protein along with the Bacillus coagulans has improvements in terms of muscle strength and all the parameters that we spoke of. And in this other study, they looked at the benefits in terms of improvement in constipation also, that was also improved in this study. And so I think this is how we see that addition of the probiotics to the protein formulations, whey protein formulations, does have certain benefits. And what is the role of dietary fiber? Dietary fiber also, as we know, we are speaking of, when we speak of dietary fiber, we speak about insoluble dietary fiber and the soluble one. Soluble one is the fermentable one, which could be either be viscous or non-viscous, and then the non-fermentable fibers are present in are the non-viscous ones, which are present in whole grains, cellulose-resistant starch, and protein lignin bran. So these fibers, if you look at they have different benefits which have been shown, and we are speaking of having 8 to 25, almost about 25 grams of fiber intake would certainly benefit, have several benefits in the diet. Now, fructooligosaccharides are a type of non-digestible carbohydrates which are classified as bifidogenic oligosaccharides and are recognized as soluble dietary fiber. So these are one of the variety of soluble dietary fiber which have several benefits. As you can see here, they are hygroscopic, and they have more sweetness than sugar, than sucrose, and they can have all these benefits when they are added on to the protein formulations that we are speaking of. So the mode of action is that they undergo fermentation by the colonic bacteria, and that promotes the growth of certain microbes, and it reduces the colonic pH, inhibits the growth and proliferation of the harmful bacteria. It potentiates the growth of the beneficial bacteria. and so it translates towards several benefits in terms of improvement in gut motility, alleviating constipation, facilitating mineral absorption, and also having an immunomodulatory effect. So there is data from various studies which have been on small number of patients which have clearly shown that there is benefit of this fructose oligosaccharides on gut microbiota and also on various other parameters. So I think I will conclude here by saying that muscle loss is very important. Building up muscle is very important today. If you want to have a good health, we should focus on improving the muscle strength and build up muscles, because muscle loss begins at the age of 30 years and it is influenced by several factors. So if we are able to influence those factors and favorably change those factors and prevent muscle loss, that is another important thing that has to be done. And muscle integrity is maintained by the nutritional factors which should be favorably altered, and maintaining healthy gut microbiota is very important in terms of improving various health outcomes. High protein supplementation is very important, and when it is combined with pre and probiotics, it may add benefits, particularly with agents like Bacillus coagulans, unique IS2, and fructooligosaccharides that are present in some of the formulations that provides the additional benefits in terms of not only improving the nutrient absorption but also improving the muscle strength. So with that, I'll conclude and I'll thank you all for the patient hearing. Be happy to take up any questions.
Thank you, Rakesh sir. As we run short of time, I think we'll take one or two questions.
So just not about apart from the protein nutrition which you mentioned, I just think the value of in respiratory sarcopenia, the value of yoga, they say particularly pranayam can do a lot of good for the muscles, so the intercostal muscles, diaphragm and the accessory muscles. Yoga may have a role to improve the sarcopenia.
Yes, sir, absolutely, sir. I think that's a very important point that you brought out, that yoga has benefits not only on various muscles, all the muscle groups, I would say, because the breathing exercises, as you said, improve the intercostal muscle strength, and also the accessory muscles, and also have a beneficial effect on the psychological benefits, several psychological benefits also, which add on to that. So overall, there is improvement in immunity and various other benefits that are being shown in several studies now.
Sir, I've got a question for you. Like, if you're going to increase a dose of protein, you're going to give a high protein diet, give a probiotic, that's fair enough. But do you think that alone can increase the muscle mass, but you need to do exercise also, right? Rather, just giving the protein doesn't mean that it is going to increase.
Absolutely. I think that's a very important point that you brought out, that we were discussing about all the factors that are influencing the muscle mass itself, and it's not one of them which can have a favorable impact. All of them have to be addressed. We need to address those. Exercise becomes a very important factor in addition to improving the protein intake.
Yes. I think we don't have any more questions. Thank you, Rakesh sir. Thank you, chairs. Thank you all. Let's move on to the next question. Next session.